We often say that judges, teachers, and doctors are noble professions, built on conscience. If the integrity of these three fields is compromised, it means we can no longer safeguard justice, social morality, or the sanctity of life. However, in the United States, there was a quack doctor who was practically the grim reaper of the medical world. With zero professional ethics and lacking proper qualifications, he still performed gender reassignment surgeries on 500 people. And the locations? Completely random. Small clinics, garages, even motels became his operating rooms. He made a fortune doing this. It wasn't until a bizarre, botched amputation surgery that this grim reaper's medical career was finally exposed. Hi, welcome to my channel. I'm Evil Eggplant. Today's story begins. May 10th, 1998. 79-year-old retired engineer Philip Bondi was found dead in room 609 of a Holiday Inn. His left leg was missing, and the stump was oozing a large amount of blood. Strangely, a friend of Philip's initially told police he had been hit by a taxi in Mexico. But if that were true, why was the body in a hotel room and not a hospital? If he really died in a traffic accident, why did no one call the police? Obviously, this story wasn't credible. Police quickly found two receipts for $5,000 in the hotel room. One was labeled surgery, the other hospitalization. They were signed by a man named John Brown. After some investigation, police located John's apartment. He seemed polite and spoke well, but clearly appearances were deceiving. The inside of his apartment was a disaster. Dirty dishes piled up in the sink, books and medical supplies scattered across the floor, and the smell was indescribable. John wasn't surprised by the police visit. He knew they were there about the man who died in the hotel. According to John, he drove Philip to a clinic and visited him at the hotel the next day to check the wound. He admitted seeing some redness, but claimed it was a light gray color, indicating the wound was becoming gangrenous. When police asked if he performed the amputation, John refused to answer. Meanwhile, investigators found blood-soaked towels, sheets, anesthetics, and surgical instruments on the ground floor of the apartment. John had no defense. It turned out Philip suffered from body integrity identity disorder, BIID. He desperately wanted to amputate a healthy leg to become disabled. No legitimate surgeon would ever agree to this. So someone like John, who ignored all standard surgical procedures and operated anywhere, became Philip's savior. Most importantly, John didn't do pre-op assessments and didn't care about post-op care. He lured in desperate patients with incredibly low prices, caring only about the money. The friend who claimed Philip was in a car accident was actually another BIID sufferer. He had planned to get an amputation from John too, but backed out at the last minute, a decision that saved his life. Sadly, Philip died of gas gangrene. After the truth came out, John was charged with second-degree murder in California, a very serious charge in a medical case. A surgeon testifying for the prosecution stated that John failed to leave enough skin flap during the surgery to properly cover the bone and stump. The flap was pulled too tight, cutting off blood flow, causing the tissue to die and leading to a Clostridium infection and gangrene. Digging deeper, it turned out John's medical record was stained with misconduct. He was known as the butcher of the medical world. As early as 1990, he served 19 months in prison for practicing medicine without a license. But surprisingly, after his release, John didn't give up. He went right back to his old tricks. John was born in 1922. His father was a strict and cautious Mormon doctor. Influenced by his father, John showed exceptional talent and followed in his footsteps, graduating from the University of Utah School of Medicine. He began a 20-year career as a general practitioner. However, during a thyroidectomy, he nearly lost a patient. This made him determined to undergo training to become a formally qualified surgeon. For John, written exams were a piece of cake. But whenever it came to the interview stage, he would freeze up. Faced with authority figures, he invariably messed up. This stemmed from the psychological barriers created by his domineering father's strict upbringing. But John never thought the problem lay with him. Instead, he internally blamed the medical board. Later, John served as chief resident in a plastic surgery program at a hospital in Newark for 2 years. But he never obtained certification from the American Board of Plastic Surgery. This deeply frustrated him, as he knew he needed more practical experience. Since the 1970s, John found a different path, a niche truly his own. At a time when most doctors viewed transgender people as freaks, John appeared. He accepted almost every gender reassignment surgery that no one else was willing to perform. Strictly speaking, out of every 2,000 patients wanting gender reassignment surgery, only about 24 truly met the criteria, and they faced long waiting lists. But with John, it wasn't that complicated. As long as the patient was willing to pay, surgery could be arranged immediately. However, because he didn't have a surgical license, he could only see patients in small clinics. The surgery locations were wildly varied. His own garage, motels, even on a train. At the same time, John attracted customers with low prices, which was a godsend for those with limited funds. Soon, John set up clinics in San Francisco and Los Angeles, specifically providing gender reassignment services to California's marginalized transgender community. He skyrocketed to legendary status among the U.S. transgender population, revered as a gender reassignment expert. However, as more people sought John out, his already low standards plummeted further due to high demand. A patient named Elizabeth once went to John for reassignment surgery. The removal went well, but a year later, the constructed female genitalia began to tighten and even close up. She rushed to John for help, but he completely ignored her, passing her off to other surgeons. One of them was Jack Fisher, a professor of plastic surgery at UC San Diego. He personally repaired 12 to 15 pelvises that John had butchered. Jack complained bitterly, stating he had never seen such terrible surgery. This guy doesn't know how to make a straight incision, doesn't know how to hold a knife, doesn't consider blood loss, let alone pre-op and post-op checks and aftercare. It's no exaggeration to say, well, it was a mess. Yet despite this, John still had a legion of loyal fans. Take Patrice Baxter, for example. In her eyes, John was one of the best surgeons in America because he performed her tummy tuck, facelift, and breast augmentation. How else would a nearly 70-year-old Patrice have such youthful cheeks and a full figure? Patrice referred many friends and relatives to John. She recalled her gender reassignment surgery only cost $2,500, and half of the surgeries for her friends and family were free. Patrice firmly believed John was a smart and talented man, whose only flaw was an occasional lack of common sense, which didn't affect his work. Generally, at a legitimate hospital, transgender individuals not only have to take hormones for years, but also pass psychological evaluations and physical screenings just for the chance to have surgery. And the cost could be as high as $20,000, with a wait time of 7 or 8 years being normal. It's said that during the craziest times, whenever news spread that John was coming to town, many people would scramble to scrape together money, waiting to get surgery from him. With John, the process was simplified to the extreme. Basically, hand over the cash, and he makes the cut. For $2,000 or $3,000, you could have the female genitalia you dreamed of. Pay another $500, and John would throw in a facelift, breast augmentation, or butt lift. If you only had $200 or $300, no problem. John could inject silicone wherever you wanted. For those not financially well off, this low-price temptation was hard to resist. However, you get what you pay for. From the victim's complaints against John, we can see just how terrifying a botched surgery could be. Some had their male genitalia removed, but because the price wasn't right, the surgery was only half done, leaving the transition incomplete. Then there were the very common issues: folliculitis, peritonitis, and permanent colostomies. Some people ran out of money mid-surgery and were dumped in alleyways or parking lots to fend for themselves. Often, these people, already ashamed of their transition, suffered in silence. In 1984, John's clinic ran a promotion, 2 for 1. Cherry and her brother went to the clinic together, planning to get gender reassignment surgery. But when Cherry arrived and saw the sanitary conditions, She backed out. The operating room was just a converted bedroom with a gynecological chair in the middle and insufficient running water. John performed the surgery while drinking coffee. Most critically, John's technique was extremely rough. After the surgery, he would grab the blood-soaked bandages and rip them off. After her brother's surgery, Cherry stayed in the clinic to care for him. In just those 10 days, she heard all sorts of bizarre and absurd cases. For instance, while performing a facelift and breast augmentation, John accidentally severed a nerve in a patient's face, leaving them with a permanent, eerie grin. That wasn't all. The breast implants failed, turning black and rotting, occasionally oozing a mysterious liquid that smelled like cat urine. Or the time John actually installed the female genitalia backwards. I'll let you imagine that one. Then there was the unlucky Camille Rock. In November 1997, John performed her gender reassignment surgery. To prevent the opening from closing during healing, John gave Camille a stent shaped like a male organ. As for the material, unsurprisingly, it was just Styrofoam. John told her it had to be kept in place, or everything would fall out when she stood up. So, Camille stayed home obediently, terrified to move an inch. But to her horror, the situation down there gradually worsened. To put it simply, waste was coming out of the wrong place. Camille's bladder became blocked, her lymph nodes swelled, and her skin turned jaundiced. She hiccuped constantly. About 5 days later, Camille thought she was dying. Fortunately, a friend visited, found her lying in her own filth, and rushed her to the hospital. The scene shocked even the doctors. Camille was in excruciating pain, screaming almost 24 hours a day. During surgery, at least 6 doctors surrounded Camille. Her rectum had been punctured during the previous surgery, and waste was flooding into the unhealed wound. Miraculously, the surgery was successful. Afterwards, Camille learned that before the operation, the doctors had already ordered a body bag. Actually, as early as 1977, a patient had filed a lawsuit, and John's medical license was revoked. But he didn't stop. He continued practicing outside of California, even advertising his clinic aggressively to drum up business. But as complaints mounted, John's reputation in the transgender community plummeted. Unless they were desperate, no one dared to take the risk with him anymore. In May 1998, Philip died from the amputation. Police needed to find substantial evidence of John's malpractice. Camille stepped forward. She proved she had spent $60,000 trying to fix the body John had ruined. Police quickly followed the trail and contacted many victims. Finally, John was sentenced to 15 years in prison. However, not long after, John's health severely deteriorated in prison. He developed many issues, including severe complications from pneumonia. He died on May 16, 2010, ending his absurd and outrageous life. All along, John knew that practicing medicine without a license was illegal. Yet he still exploited the desperate situations of his patients, using extremely unprofessional methods to make blood money without a shred of medical ethics. It was a vicious cycle. Many victims, after suffering botched surgeries, blamed their own bad luck, which only emboldened John further. It can only be said that people like this are a cancer on the medical world. The sooner they are caught, the fewer victims there will be. All right, that's it for this video. What do you think about this gender reassignment expert? Let me know in the comments below. If you liked this video, don't forget to like, save, and subscribe. See you in the next one.